Veterinarians say the choice to spay or neuter your pet may be the most important decision you make, impacting their long-term health. We welcome back this morning Tiffany Burke. She's the Director of Education at the Bay Animal Hospital to talk a little bit about this topic. Now, before we get into the why, you brought some little props today. We'll talk about these fashion choices maybe in just a moment. But first, tell us, why should someone spay or neuter their pet?
That's a great question. It's a great lead off, and thank you for having me back again today. Of course, it's so much fun being here with you. And spaying and neutering your pet is directly linked to significant health benefits for both your cat and dog. It greatly reduces for your female pets uterine infections, mammary or breast cancer, and also for your male dog, greatly drops the risk for prostatitis, prostate cancer, testicular cancer, and the desire to roam. And on this image, it shows a couple of those in more of a cartoon format, and it's a big deal. We reduce aggression and all sorts of things. So really look at this image, study it, take some notes, because spaying and neutering's not only linked to health benefits, but also some great behavioral benefits too. Yeah,
for a number of people out there, I'm sure over the years you've heard, rest in peace, Bob Barker talking about controlling the pet population, but interesting to note that there are health benefits. Dive in a little bit more to those behavioral benefits though.
Oh, great. Yes. So behavioral benefits for your male and female dog, there are both. For a male dog, there are studies out there for intact male cats and dogs. They have a really increased desire to roam or look for the ladies. 90% of all hit by car pets are intact male cats and dogs.
Wow. Did not know that.
Yes, definitely. So it curbs their risk to roam. For your male dogs, it also decreases their aggressive behavior or aggression tendencies. So it helps them become more of a friendly pet per se. I know.
You always bring the cutest pictures. Let's talk about surgical options.
Yes, surgical options. So for your female pet, you're going to be looking for a word called spay. That means removing the reproductive organs for the female. And neutering or castrating is removing that for your male pets.
Gotcha. What is this today? Because I wasn't familiar. Talk about what this is all about.
Sure. So when an animal recovers from surgery, sometimes they have a desire to lick or chew at their incision, which for females, it'll be on their ventral midline or their abdomen. For males, it's between their legs. And this little onesie, for lack of better words, can keep them from licking and chewing their surgical incision.
To protect them.
It does. I prefer an e-collar, or we call it maybe a cone of shame.
Sure.
But not all pet needs them. It's not one size fits all protocol, and our goal is to keep them from causing complications after the surgery.
Gotcha. And then with all this said, when should you spay or neuter your pet?
Well, it's not one size fits all. In general, 7 months of age or greater for cats and dogs, but some dogs are very large in their breed size. Your mastiffs, your giant breeds, those breeds we like to spay and neuter later so their long bones can grow and develop. There are some studies out there that have gleaned our veterinary teams to recommend later in life. So if you have a question or you think you have a larger giant breed dog, call your vet, ask those questions ahead of time prior to scheduling.
Gotcha. And then, after all, it is a form of surgery, so any risks involved there?
There are risks. Anytime a pet undergoes anesthesia, there are risks. And as your veterinary team, we like to stack our card deck very favorably. We do a full physical exam prior to anesthesia, preoperative anesthetic blood work 1 or 2 weeks prior to ensure that biochemically their organs are ready to go for anesthesia, and we monitor them while they're under anesthesia with our hands, our stethoscopes, and very advanced monitors.
Gotcha. As always, we always learn so much from you, Tiffany.
Oh, thanks.
Yeah, our thanks again for you coming in, Director of Education here at the Bay Animal Hospital. As always, if you have any questions, ask your vet, right?
Yes, please.
Yeah.